Hello everybody, my name is Kayla and I'd like to welcome you to your recovery. Pain in the back of the head or base of the skull can be an extremely debilitating symptom that is oftentimes related to suboccipital muscle dysfunction. I myself had chronic skull base pain for several years. I can attest at how truly miserable it is to have the back of your head burn and ache constantly. At this very moment, I have absolutely no skull base pain. I have no neck pain, and I've even been able to rid the throat pain that I was experiencing. In addition to intensive massage therapy and integrative dry needling, I was able to incorporate a neurokinetic technique into my healing regimen and also an anterior neck release. I believe the combination of these therapies and the frequencies at which I received and performed them made all the difference for my recovery. In this video, I'm going to go ahead and discuss and demonstrate the neurokinetic technique and anterior neck release that have helped me to recover. If you like this video, be sure to give it a thumbs up. It lets me know that you enjoy what I'm doing and that I should do more of it. Please share if you feel compelled, and as always, my comments are open. The first thing I'm going to show you is the neurokinetic technique that was taught to me by Dr. Aaron Locke. Dr. Locke is a chiropractor based out of Westlake, Ohio. In addition to chiropractic, he's also certified in neurokinetic technique and also the fascia distortion modality. Essentially, Dr. Locke can perform chiropractic adjustments, neuromuscular therapy, and also myofascial work. I've seen Dr. Locke one time. I would see him more, but Westlake is a bit of a drive for me. During that appointment, he was very professional, very informative, and he was completely fine with not performing any sort of adjustments on me. Dr. Locke says most of his patients choose not to be adjusted. He simply applies his extensive knowledge of the neck and spine to perform his NKT and FDM modalities. I absolutely would see Dr. Locke again if you were a little bit closer. I would like to see him at least one more time in the future, especially to see what he thinks about the progress I have achieved with the technique that he's shown me. Dr. Locke did an examination, determined that my suboccipital muscles were affected, especially on my left side, which I absolutely agreed with. I have determined that the muscular dysfunction I vocalized about on my left side, that flat spot, the muscular depression, I do believe that was the suboccipital muscles. That's what I was feeling at the time, and Dr. Locke agreed when he felt those suboccipital muscles. He said the left side is highly affected. He then instructed me to go ahead and perform a suboccipital release by simply massaging the suboccipital muscles for about a minute, and then following up that massage with 2 or 3 chin tucks to activate the deep neck flexor muscles. I was instructed to perform this activity 3 or 4 times a day to retrain the brain. That way the brain would know to turn off the suboccipital muscles and turn on the deep neck flexor muscles. I believe my occipital muscles were dysfunctional. They were attempting to do more work than they were supposed to. It was causing a lot of strain, a lot of tension. It was contributing to my dizziness, my visual disturbances. The suboccipital muscles are connected to your eyes. Dysfunction in this area can cause a lot of different symptoms. Again, just the simple release and activation that I was shown made an absolutely incredible difference, especially when paired with the next thing I'm going to talk to you about. In addition to the issues on my left side, I began experiencing some atypical throat pain, especially right here in between my collarbone, right where the SCM attaches to that clavicle. I happened to come across a video from Dr. Mandell, the motivational doc on YouTube, that focused on anterior neck release. This video really caught my attention because Dr. Mandell immobilized the exact area where I was having pain. This pain I was experiencing was like a deep pulling. I mean, I could really just dig in and feel those muscles were tight and tense. It was like my muscles were trying to pull down on my neck. It was really an uncomfortable feeling to experience. Again, atypical. You know, I'd been diagnosed with glossopharyngeal neuralgia, which is a little more up here, actually in the throat, or even in the back of the mouth on the tongue. So this atypical throat pain I really was not sure of, and I wasn't sure how to manage it. Enter Dr. Alan Mandell with his anterior neck release. I simply adapted his approach, added it to my NKT technique, and over time of doing both of these techniques together for just a few weeks, I've been able to really overcome this pain, restore my range of motion. It's been absolutely incredible. So now that you have all the information, all of the references, I'm going to go ahead and demonstrate both of these techniques so that you can see exactly how I perform them. All right, now I'm going to demonstrate how I perform self-administered suboccipital massage. I do have my babies set up playing in the other room. I apologize in advance if any of their chatter is distracting. I appreciate you bearing with me. I'm just trying to push through so that I can get this video done. And again, I apologize in advance. Without further ado, here's that self-administered suboccipital massage. To locate my suboccipital muscles, all I have to do is put my head in my hands. I'm proportionate enough where my thumbs just naturally fall right here where the suboccipital muscles are located. If I were to need any additional help locating these muscles, I can always palpate for the occiput, that rounded, bony part of the back of the skull. You can feel that round bump, and right below the occiput, suboccipital, are those muscles. There's a rounded bump here. That's the occiput. There's a pointed projections on either side. This is the mastoid process. And then I can even palpate some of the transverse processes of my cervical spine, the very outside of those spinal vertebrae. So once I've identified my suboccipital muscles, I go ahead and just begin with some circular strokes. Now I can do large circles, or I can do small circles, work on the occiput, mastoid process, transverse processes. I can get those suboccipital muscles. I can move slowly, or I can work a little bit faster. I used to have a lot of symptoms, a lot of flares when doing suboccipital massage, but building up my massage tolerance and working through, releasing my trigger points and promoting muscular balance has really increased my tolerance for massage. I can have my massage therapists get in the suboccipitals and really, really do some good work. And again, I also have my suboccipital muscles dry needled as well. I was instructed to do the suboccipital release with massage for about 60 seconds. Generally in bodywork, 90 seconds is a very magical time frame. If you can get into a position where you're pain-free and hold that for 90 seconds, you can reset the neural pathways in your brain and reprogram those chronic pain responses. Now, after 60 seconds of the suboccipital massage, I'll follow up with some chin tucks. We can do 1, 2, and 3. Now, I enjoy doing my chin tucks with some active resistance. Active resistance, I'm just going to push with my hand onto my head and push back into my hand while I do those chin tucks. And that really encourages additional muscle activation and really gets those neck flexors good and fired up. So that's it. That is the Neurokinetic technique. Release the suboccipitals, activate the deep neck flexors. I did this 3 to 4 times a day after working up to it gradually, and I really found it helpful and effective. The next thing I'm going to demonstrate is Dr. Mandell's anterior neck release. I'm going to be completely transparent about this release. When I first discovered Dr. Mandell's YouTube video, I was very intrigued by his technique because that atypical throat pain I was experiencing was exactly where Dr. Mandell demonstrated to immobilize, to perform the release. But I was very nervous because I hadn't been using my neck normally for a really long time. at my worst, it felt like I was just nailed to a board, like I had a straight board up and down from my head down to my mid-back, all the way down in between my shoulders, like I was just nailed to this stiff board, like I was stiff. I'd have to move my whole body to move anything or do anything. I mean, I did not, look up or down very much. I really only looked left or right as needed. Even then, doing so oftentimes induced my symptoms, so I never really held the position for very long. So the idea of looking up and tipping my head back was a little concerning for me. But again, Dr. Mandell's demonstration focused right where I had a pain and a pulling sensation right here. It just felt like everything was tight and pulled, like my neck was trying to pull down. It was a very miserable sensation to experience. So I did go ahead and decide to try Dr. Mandell's technique, and I personally had excellent success. The first time I did this technique, I essentially just got into the position, got right back out. I told my body, it's like, we can do this, we are okay. I'm a big fan of experimenting. You never know until you try. And if something is resonating with me and I feel like it could be beneficial, I mean, who in their right mind wants to go and get intensive deep tissue massage and have their face dry needled and the suboccipitals dry needle? Like, it's not, it's not fun sometimes, but the results that you achieve, for me, it's always worth a little bit of experimentation, taking a little bit of a risk. That being said, low and slow, honor your tolerance. Anybody who would like to try this exercise on their own, be sure to do your research, consult your healthcare professionals. I'm going to go ahead and demonstrate this anterior neck release just for reference and informational purposes. Go ahead, mobilize right here in between the clavicle. Pin that muscle down, look up, all the way back. You move a little more laterally, immobilize the sternal attachment of the SCM. It'll give a little more release to those muscles specifically. Do the same thing, immobilize, look up. Clavicular attachment, one more time. My left side's my affected side, but I can go ahead and do the right side too. Clavicular. And doing both sides, I could feel just a little bit of difference. My clavicular attachment of the SCM on my left side was just a little bit more tense than the clavicular attachment on my right side, but everything has been done and released. I can even feel that a bit up here because all of these muscles are connected. Everything has tension here to suspend the hyoid, to enable your throat functions. It's incredible the amount of muscles that are there in the neck and under the throat. But that's it. That's the entire anterior neck release. I, again, was very cautious with this. I did feel a lot of release. I experienced some crepitus while doing this activity. Crepitus is any sort of noise that you may perceive when moving a joint. A lot of people, they describe their noises differently. It can be cracking, clunking, popping, bubble wrap, creaking, grinding. I've heard many different descriptions for neck crepitus. My crepitus is generally cracking and creaking. Get like a squeaky noise sometimes that I perceive over here on the left side, but just a little bit. I still haven't quite figured that one out, but it's not bothersome for me. My neck really doesn't make noises anymore. My shoulders don't make noises anymore, but I did experience, some cracks that indicated some self-adjustment in my cervical spine as a response to doing the anterior neck release. So I personally felt relief from the release and these cracks that I was experiencing. It literally felt like my AO joint, the atlanto-occipital joints, where the atlas bone joins to the occiput, the back of the skull. I just felt that joint unlock, and it's been incredible to have that range of motion back. I can look all around. I have that whole range of motion. I can look behind me. Do some dynamic turns all the way back, and I'm working on looking down, but I have a little bit of tension and restriction in the paraspinals and down the rhomboids and erector spinae muscles, probably just from my body compensating from everything that was going on. And even it's natural, in our society, from us looking down, even performing work in the home or in the workplace, that those muscles can get tense. So I'm still working on it a little bit, but other than that restriction, I don't feel like that muscle tension causes me any issues. So it's been very relieving to restore that range of motion in my neck, be able to use my neck more normally. I can take drinks, I can gargle, I can, look around when I'm in traffic instead of having to just rely on my mirrors. It's been very liberating to be able to restore my neck function. Now that's everything that I have for you guys today. I hope that you enjoyed the information that I was able to share. I dedicate this video to my friend Stacy. Stacy, I send this to you with every intention of relief and recovery, and I really do hope that this can make a difference for you. And everybody else out there, keep going, find what works for you, and please let me know, what therapies are you doing? What techniques have you found that have been very helpful? Are you working with a skilled local practitioner? Let's lift our practitioners and praise. Again, thank you for joining me. I really hope that this was helpful, and I will see all of you again next time.